On this channel, we've consistently made the case in favor of Medicare for all. But now more than ever, new data is showing that Medicare for all is the only way forward for working class Americans. According to the New York Times, from February to May of 2020 alone, 5.4 million Americans lost healthcare, lost access to healthcare via their insurance. 5.4 million Americans. That's a record not only for a 3 or 4 month period in any one year, but between February and May, just those months of this year, it's been a bigger loss than in any one total year ever. So it doesn't even include losses in January that weren't connected to this crisis, and it does not yet include losses from June and so far in July. So those numbers are almost certainly even higher, even more record-shattering in all the bad ways, in all the wrong ways. Medicare for all was always the right move. It was always the obvious move. It was always the clear decision for any decent, humane, and just order to move towards. We knew that. If you're watching my videos consistently, we all agree. But we have to also agree that this crisis has shown in starker terms than ever why that coverage is needed and why the employer-based insurance model fails so drastically when times like this happen. When your model is predicated on the fact that you need to have a job, or your spouse needs to have a job, or your parents need to have a job if you want healthcare access, and then people, for whatever reason, en masse by the millions, start losing their jobs, then millions are also going to lose healthcare. And other options won't be available because saying, oh, you can go on Cobra, saying you can buy individual insurance doesn't work, because more often than not, people without jobs don't have any money, especially money to pay for overpriced insurance, overpriced, under-effective insurance. It's just not feasible. So what happens is people not only stress about losing their job and losing their home potentially and losing their food for their children and all their extra things that they have, but of course, now they also worry about getting sick and not being able to get treated, or having an existing issue and no longer being able to treat it effectively. So you're just adding stress upon stress upon stress upon stress. This time is already stressful enough. It should not have the added stress of, what am I going to do about healthcare? And this is why Donald Trump, yes, especially, but even Joe Biden, utterly fail to rise to the occasion when it comes to healthcare. 100%. I want to read you an excerpt from the New York Times article because it shows just how awful this situation is in historic terms. The estimated increase in uninsured laid-off workers over the 3-month period was nearly 40% higher than the highest previous increase, which occurred during the recession of 2008 and 2009. In that period, 3.9 million adults lost insurance. We knew these numbers would be big. This is the worst economic downturn since World War II. It dwarfs the Great Recession. So it's not surprising that we would also see the worst increase in the uninsured. Well, exactly. It's no surprise. It's no gosh darn surprise, because when you link healthcare to employment, recessions, downturns, whatever you want to call them, also lead to healthcare crises. And it shouldn't. It shouldn't lead to a healthcare crisis. No one's suggesting that with Medicare for all, every problem would go away, but one awfully big one would go away. And it's not even about Joe Biden's do-nothing public option, which would utterly fail workers in this crisis. So much from Joe Biden has been talking about Obamacare, the Affordable Care Act, how it would make all the difference, and we need to champion it, celebrate it, and expand it. But as this notes, the Medicaid expansion under the ACA has not done nearly enough to protect people from going uninsured. So the Biden model, the one that he wants to build upon, has still failed millions of Americans. The article notes here, in the 37 states that expanded Medicaid under the Affordable Care Act, 23% of laid-off workers became uninsured. The percentage was nearly double that, 43%, in the 13 states that did not expand Medicaid, which include Texas, Florida, and North Carolina. So there were benefits. Less people became uninsured due to the Medicaid expansion under the ACA. But let's be real. That means more than a fifth of all workers, when losing their job under the Obama-Biden model, also lost their healthcare insurance. It's unacceptable. Absolutely unacceptable that millions of workers under Biden's model would lose their care. And you'll say, well, if Biden gets to implement his full model, then what's going to happen is those workers that lose their job, that lose their workplace health care, will just be able to slide onto the public model. But what about cost? There will be costs involved. They're still going to have to pay for it. Workers that just lost their job might not have money to buy into the public option. They'll almost certainly see a decline in their health care. And further to all that, imagine the administrative burden of immediately registering 10, 20, 30, 40 million Americans with vastly different needs onto the system. Whereas with a Medicare for all universal single payer model, everyone's on it. There is no private health care. There is no need to, as a, last minute emergency resort, switch people over because they got laid off from their job, whether it's temporary or it's permanent, just because they need health care to survive and the employer-based model has failed. So when people are like, why are you making such a big deal about Medicare for all? Bernie lost, Joe Biden won, suck it up and, be happy with the public option that you're going to get. This is why we're mad. This is why millions of people, some of whom are still going to vote for Biden, but many of them are saying, I can't. They're mad because this model is broken. It was broken before. The employer-based model is still broken. It's broken under the best of times. Again, we've covered this so many times on the channel. 10 million Americans under Biden's own plan, ideal situations, pre-crisis, would be uninsured. 10 million. What do you think Biden's public option plan is going to let slip through the gaps during a crisis? How many million of Americans right now, even under Biden's ideal plan, would be suffering without health insurance? 20 million, 30 million, 40 million? I don't know. But what I do know is it's going to be far more people than the 0 people left out of Medicare for all, which is universal single payer. This is the moment to keep pushing Medicare for all. Don't give up on it. This crisis has demonstrated beyond a shadow of a doubt that the only way that working and middle-class people can have peace of mind with their health care is when it's universal, single payer, via the government, no ifs, ands, or buts.